see the difference between half face that was sun exposed for all his life and the other one that was covered inside the truck. And the other case, it's like twin sisters. I put there half face of each woman. So one of them has been sun protected all her life, and the other one sun exposed. So at the age of 50, you can see the difference between half face. And here a picture that how scary you can be when you don't avoid the sun all your life. You scare children at the beach. So we need to understand how it works. How does the sun that is so vital to us can be so harmful also? So we need to be focused on the part that the UV radiation, that is the ultraviolet radiation, it's part of the natural energy produced by the sun. So we have three types of wavelengths of ultraviolet rays. We have UVC, that's almost everything filtered by the ozone layer. You have UVB, that just partial amount is filtered. So we have a lot of UVB here on us. And we have also UVA, that have the longest wavelengths, so it's the more harmful to us, that we have more here. And UV light has shorter wavelengths than the visible light, so we don't see it, but it's everywhere, all the time. So when we think about UV radiation, you need to pay attention to photoaging and photocarcinogenesis, and I will show you how it happened. So here we need to focus on the rays that are more important to us. So UV rays, the UVA rays go deeper in our dermis. They don't stay just on the epidermis, they go deeper, and they are associated with skin aging and pigmentation because they will break the elastin that we have there. And you have the UVB rays. UVB rays are shorter than UVA, and it's more associated with sunburn because it's more superficial. So it will stay in our epidermis doing blistering and sunburns if you don't pay attention to it. But both of them can lead to skin cancer. So, some important points about UVA. So, UVA, when you see the sunscreen at the pharmacy and you have the broad spectrum protection, it's related with UVA. This is the kind of protection that you need to look for when you want the UVA protection. The UVA is everywhere. It's up for 95% of the radiation, and they can penetrate windows and clouds cover. So every day when you have cloud days, you need to protect of this because it's everywhere. You don't need to see the sun rays to have these effects. And UVA rays maintain the same level of strength all over the year. It doesn't mind if it's winter, it's summer, it's there all the time. And it's the main type of light used on the most in tanning beds, because on the other days, older days, used to think that UVA rays are not bad for us. So this is why we have so many cases of skin cancer of people that are used to use tanning beds. Then UVB, overexposed, causes sunburn and blisters, as I told you, and it's connected to the sun protection factor, the SPF. So when you see the SPF, it's for UVB. And your intensity fluctuates. So during the summertime, it will be worse, and during the periods of the day, like the late morning and midday. And you need to pay attention even of surfaces that reflect, like snow. So you go do snowboarding. So this is the ray that you need to avoid. But they can be filtered and do not penetrate the glass. So we are covered here. And here I have a cascade to explain how it will make the skin aging. So here we have the UVR, that can be UVA and UVB. The UVA will produce the reactive oxygen species. They are very harmful for our cells, for our skin cells. And UVB will produce photoproducts that we call cyclopyrimidines that will cause DNA damage. So UVB will affect more indirectly with these subproducts. But what is happening? It's not going. So, how does it work? These things will promote the activation of cell cycles checkpoints. What it means? It will induce apoptosis. This apoptosis will activate the DNA repair. So constantly, you will repair. And your body can repair just a amount of this damage. So it's impossible to repair everything. So this is when the problem starts, because the damage of stem cell niche will make the depletion of our stem cell, and also the damage of dermal fibroblasts. And we know the fibroblasts that produce the collagen. So it will make epidermal stem cell depletion and loss of extracellular matrix integrity. And this is how we have the skin aging. So let's talk right now a little bit about photocarcinogenesis. The most important type of skin cancer are the non-melanoma skin cancer. Not the most important, but the most prevalent, the most common. About 90% of non-melanoma skin cancer are linked with this exposure, the UV radiation. And the most common, it's the basal cell carcinoma. It's really, really prevalent. It's like 4 million cases each year in the United States. And it's followed by squamous cell carcinoma, that's the second most common. And we need to really pay attention in organ transplanted patients, because they have like 100 times more susceptible to develop squamous skin carcinoma than the other parts of the population. And here, here I want to show some patients, mine, at the hospital. All of these lesions are basal cell carcinomas, that, as I told you, is the most prevalent. So you can see that you have a variety of colors, of presentations. So it's really challenging, because you need to pay attention to all details. All of them were biopsied, so you have the confirmation, and then you can plan the surgery, because the surgery will be different for each kind of them. The other type, that's the worst one, it's the melanoma that we're more worried about, because an estimated 7,000 people will die from melanoma in 2019. 8% of melanoma arise on apparently normal skin. So you don't need to have a mole, a previous mole to appear. It can appear on normal skin. And the risk of melanoma double if a person has more than 5 sunburns for his life. But if you have in our childhood just once with blistering, that really high sunburn, you more than double your risk. So it's really related to this. And how can you avoid? You can avoid daily use SPF 15 or higher. It will reduce on 50% of your melanoma chance. And it's really important, because in men age 49 or under is the most prevalent type of cancer. They have more chance to have melanoma than other type of cancer. And for women at the same age, it just follows the breast and thyroid cancer. Here we can see all these lesions are melanomas. It's from Mayo Clinic. So you can see how asymmetric they can be. They have the borders that are really not well delimited. The colors, we have more than 3 colors. If you see a normal mole like this, you have like 2 colors, and melanoma you have a lot of colors. And you need to pay attention also to the diameter. If it's bigger than 6 millimeters, you need to pay attention. And other really important things, it's the A from our ABCDE from melanoma, it's the evolution. If you have moles that are getting bigger on your adult age, it's not a good thing. So you need to remove, you need to go to your dermatologist. Here you have the type of treatment you can do. It will depend on the size, the type, the depth, and the location of the lesions. We have cryosurgery with liquid nitrogen that will freeze the lesion for more superficial, like actinic keratosis. You have the excisional surgery with flaps or skin grafting. That is what I do more. You have Mohs surgery. That's a specific type of surgery when you remove directly the part of heavy skin cancer, and you look at the microscope to check, and so you do all the surgery looking up at the microscope. And for more spread lesions that go to other parts of the body or lymph nodes, you have radiation therapy, chemotherapy, and also biologic therapy. So surgical treatment, it's what I do more. It's not good. So here we have some flaps that I did in patients who have 2 lesions of carcinoma basocellular. So I did like an advancement flap combined to close this. At the end it will be really statical. And here another case where I combined 2 rotation flaps to close this lesion on the woman's nose. That's a really common place to appear, these lesions. So let's talk about a little bit about photoprotection. How you can avoid to have this kind of cancer? The answer is always photoprotection. In photoprotection, we have primary factors that are chemical and physical sunscreen barrier. So the physical ones will reflect the UV rays. When you apply it, you are automatically covered. When you have the chemical sunscreen, after you apply, you need like 20 minutes to be covered of it. And how it works? They absorb UV rays and will do a chemical reaction liberating heat. So it's different. And it's not really good for people that have really sensitive skin because they can make some allergies. So for babies and people with rosacea or sensitive skins, I always prefer the physical sunscreen. This is an explanation about the SPF. The sun protection factor show how many times you are covered when you use it. Like you have an SPF 15. When you apply this, you are 15 times more protected than when you don't have anything. So if you have the red erythema after sun in 10 minutes with the 15 sun protection SPF, you are covered 150 minutes. So it's how it works. So, and you have also the secondary factor. There are the new medications that you have to protect the skin. There are the antioxidants and DNA repair enzymes. So they will stop the photochemical cascade that is caused by UV sunlight. So what is new here? So it's non-topical photon protection. That is the thing that we are using more. So you have my favorite one, that's Polypod leucotomus. It's extracted by a tropical fern. It's a tree of South America. And they will neutralization the superoxide anions. So it will interrupt the inflammation cascade that I show you. And what's the most important clinical use? For patients with melasma, it's really important. So I always prescribe this for my patients with melasma because it immediates the pigment darkening. So, and it will increase the minimal erythema dose. So people with really sensitive skin, you go to travel to a place with a lot of sun, you also can prescribe this. It will be really helpful. Other one, it's nicotinamide. It's the active form of vitamin B3. It will make a chemoprevention of actinic keratosis and non-melanoma skin cancer. And the last one, that's the newest, it's alpha-melanocyte. It's an analog of hormone that will stimulate the L-melanin. L-melanin, it's the melanin that's protective to us. So when you use this melanin will absorb the UV light and neutralize this, reducing the free radicals. So it's really good from people with organ transplant and also which one they have solar urticaria. And another one that are more natural agents that are new also are these antioxidants topical agents. We are using a lot of soy glycine that will act on DNA damage and pyrimidine dimer formation that is caused by UVB rays. So it's really good. Also vitamin C, that is one of the most famous antioxidants that we use every day. So the concentration needs to be at least 10%. And it's photoprotective, reducing erythema and immunosuppression. Also the vitamin E, that protects against the lipid peroxidation, and it's also important because it inhibits the melanogenesis. So the combination of vitamin E with the Polypod leucotomus that I told you, it's the perfect combination for melasma patients. And the other two natures are grape seed extract that you apply it and you introduce the edema and the inflammation, and alga extract that stimulates the proteasome peptide activity in keratinocytes, reducing the oxidative damage. So, to finish, you have some new studies that are things that are being created by the industry right now. There is a study that showed that melanin, that we always think that be protective, can also be damage for us. Because when it's exposed to UVA, it induces a superoxide and nitric oxide, and all this energy can be transferred for the DNA, creating some mutagenic CPDs, that products that I told you, after the UV exposure. So what's the point? The study showed that all these products are produced after 3 hours of sun exposition. So a challenge for the industry is to develop products that can work after the sun exposition. We have like 3 hours to reduce this damage that can be done. So you have another alternative. If you go to sun and you got sunburn, you can use this. It's in process of study. Oops. And another one, it's photolysis in sunscreens. It's enzyme, it's a natural enzyme that's naturally in bacteria and plants. We humans, we don't have this. So it shows that when you put this on the sunscreen, it will help, it will make a synergistic effect with antioxidants, reducing all the thing. The study was made in patients with Xeroderma pigmentosa, and it reduces so much the actinic keratosis on these patients that will lead to squamous carcinoma cell. To finish the vitamin D, it has been shown that people which were given high doses of vitamin D before sun exposure, we biopsied these patients and see that they have much more or less redness after the sunburn on the skin. So we are developing also medications with vitamin D, with our vitamin D. So these are my take-home message. Majority of non-melanoma skin cancer and large percentage of melanoma are associated with the exposure of UV radiation. And exposure will cause damage as wrinkles, skin aging, and also cancer, because your body can't repair everything of the damage that it makes. So please don't forget the sunscreen. It's really important. Thank you so much for your attention, for being here so early. Thank you. Okay, thank you.
Hello. Thank you for your presentation. They're great. I have a question to Dr. Renata. What kind of sunscreen is more effective?
So it will depend on each case for what you want. I use both, but if you have more sensitive screen or for babies, I prefer the physical sunscreen. Otherwise, if you are treating melasma, I prefer if they have color, that will make a physical protection also. Mm-hmm. And if you have, it will depend on the case. All of them are good. If you need to apply the right amount to be effective, so you can choose on it.
All right, thank you.
I have 2 kids, and they are both very blonde and very light skin. Okay. And unfortunately, in the family of my husband, they have a lot of cancer. So we are always afraid to go out with them to the sun, but unfortunately they also need sun. So, so when we are out, it's this balance. It's balance. So we try to go with them to this beach after 4, okay. And then I don't want to put protection on their skin, because I think they also need vitamins from the sun. So usually I put 50 plus. For myself, I also use 50 plus, but we go that late. Is it still necessary to put that much amount of sunscreen then? Because they need also sun anyways.
Yeah, it's important, because actually you just need like 15 minutes in the outside to have the good effects of the sun. And you don't need to be at the sunlight, because as I told you, the UV wavelengths, they are not visible. So when you are exposed every place. So it's important to apply, because they have really fair skin. Mm-hmm. So it's important. You can put, if you go at this time to the early morning or the late afternoon, you can put the 15, it's okay. But it's really important to put because of the UVA effect that
Still
it
50 or 15?
No,
sorry.
15. Sorry,
15 is enough, right?
Yeah, it's enough for this time. And it's
Yeah.
really important to reapply if you go to the beach, when you go to the water. So every time they go to the water, it's important to reapply. And if they don't go to the water, it's important to reapply every 3 hours.